Is Robert Hess III. I am the founder and CEO of Tertiary Consulting, which we'll go over very briefly in a moment. But today we are here to discuss the principles of prevention and the strategic.
I'm sorry, I gotta go to a live webinar now. And
that works. I'll let you go.
And so in today's discussion, we are going to cover a whole bunch of topics, and let me go ahead and advance to the next slide. So for those of you that have participated in a previous webinar, I have been working in health and human services for about 17 years. I've been working in Arkansas for, I think, about 10 years at this point, with UALR, as well as with the community health centers in Arkansas, the association. I've done some work implementing the PATH model of care with some of the health plans in Arkansas. And so Arkansas seems like a second home to me. I often joke that I wrote my 4th grade state report on the state of Arkansas when I was in elementary school, and that was foreshadowing of a really cool, awesome collaboration with many of the providers in the state. Tertiary Consulting has been around we're now 13 years, and we provide a cadre of services that we are happy to engage with anyone in Arkansas around. If there are areas that you could use some assistance, here's a high-level overview of the types of things that we do. But today's purpose is for us to deep dive, well, maybe not deep dive, but provide a mid-level overview of different theories and frameworks for prevention, and then specifically talk about the strategic prevention framework. So as I mentioned, I've been doing these types of trainings with UALR for about 10 years now, and I wanted to kind of take a different lens this year as we start talking about the strategic prevention framework again. So hopefully we're going to address some of the reasons why we do prevention and the how prevention works. And then we're going to operationalize some of those tactics or theories, I should say, some of those theoretical frameworks. We're going to operationalize them through the strategic prevention framework. So I'm hoping that those concepts connect, because we're going to start off pretty abstract. And I do see some familiar names on the attendance list. So I know several of y'all have been in this work for a long time. And so as we go through today's session, if you will please use the chat box as your platform or opportunity to engage with your colleagues across the state. Please share your insights, your ideas, your experiences, different local resources. I do not physically live in Arkansas, and so, while I do have some experience with many of the providers and different organizations that are there, you guys are obviously the local experts. So it would be great to use that chat box as a tool for information sharing as we are going through today's session. So the high-level overview, the different theories and frameworks we're going to be reviewing today. We're going to talk about primary, secondary, and tertiary prevention so we can kind of contextualize our efforts. We're going to look at universal, selective, and targeted prevention, which very often gets confused with primary, secondary, and tertiary prevention, but they are distinctly different. We're going to talk about risk, protective, and resiliency factors, the ecological systems theory, stages of human development, and principles of trauma-informed care and how they apply in our macro prevention strategies or environmental strategies. So again, we're going to start conceptual and we're going to start on an individual level, and then we're going to kind of pull back and look at what does this look like at a community level or at a population level. And so this again, today should be a fun ride. So starting off, and again, this is largely review. I'm assuming that most folks on the phone are familiar with the different types of prevention. Again, use that chat box to ask any specific questions. But there are 3 primary types of prevention, or 3, the first type being primary, which is when primary prevention is when we are able to avoid the possibility of an event from ever happening. And we do that by completely removing risk factors through environmental strategies and behavior change. primary prevention is the bulk of and a lot of the work that we do in community-based prevention, and specifically around substance abuse. This is what environmental strategies are designed to do, is primary prevention. And we will talk about how that applies and how these other types of prevention also apply. So secondary prevention is when we are able to detect a issue or a concern early and prevent it from developing further. So some very commonplace examples of primary prevention are your annual wellness exams that you go to the doctor's office for. We do, we run annual labs and do annual screenings and testing because we want to identify an issue before it becomes really significant. There are certain things, obviously, that we may want to do more frequently than annually, but for the general population that's relatively healthy, that is a perfect example of secondary prevention. We want to do screening to identify whether or not a condition is emerging in a population. And then tertiary prevention is when we are focused on reducing the harmful effects and preventing that condition from worsening. So tertiary prevention is a lot like treatment, treatment for substance abuse conditions, treatment for diabetes, physical therapy after a accident or surgery, or examples of tertiary prevention. The event or the condition has already developed, and we want to reduce its harmful effects, and in some cases, physical therapy being an example, we want to return people back to functioning. And so we'll dive into this more. Universal prevention are strategies that are applied to absolutely everyone. So universally, we're going to provide or apply these prevention strategies whether or not individuals are at risk. Some examples, and I use some public administration examples or policy examples in here around speed limits. Speed limits apply to everyone, and they are designed to prevent traffic accidents and designed to prevent motor fatalities or injuries due to motor vehicle accidents. Traffic lights are the exact same thing. They apply to absolutely everyone. Another example from a public health perspective is when we are putting fluoride in the water system to treat the water to eliminate harmful bacteria and chemicals. It applies to everyone that receives municipal water, and it is designed to help prevent the onset of waterborne illnesses. Selective strategies are strategies that target subgroups of the general population that are at a higher risk. So for example, sickle cell anemia among African Americans. We know that that is a genetic condition that is disproportionately seen or present within African American communities. A mammogram is an example because it only applies to females traditionally. And so we use those strategies due to the higher risks of developing breast cancer, right? And so selective strategies are when we start to segment that population and start focusing a little bit more on their specific needs. And then we look at indicated strategies, and those are strategies targeting individuals that have known risks or engage in known high-risk behavior. So for example, in our current state of the world with COVID-19, HIV individuals who are HIV positive or individuals that have autoimmune disorders are disproportionately at a higher risk of negative health outcomes if they were to contract COVID-19, because they have a known condition that puts them in a higher risk category, and that condition A already exists, and we are working to prevent condition B. We would use indicated strategies to help support that specific target population. I'm going to pause real fast. Are there any questions on primary, secondary, tertiary prevention and or universal, selective, or indicated prevention before we move forward? I'm looking in the chat box, so if you do have questions, please go ahead and type them in that chat box. All right, I'm going to move on, but please feel free to add those questions at any point in time. So again, things that I assume that most folks on the phone have some familiarity with are risk factors. So by definition, these are characteristics at the biological, psychological, family, community, or cultural level that precede or associated with a higher likelihood of negative outcomes. What I think is important for us to pay attention to in our prevention work is that risk factors exist at multiple levels. And we're going to talk about the ecological systems theory in just a couple of slides. And at each level of that ecological systems model, or that theoretical model, there are risk factors, and there are protective factors, and there are resiliency factors that apply. And so risk factors at the individual level may be their individual genetics, their predisposition, et cetera. In relationships, that has to do with family structure, it has to do with incidents of abuse, interpersonal violence, and or support. In communities, poverty is a significant risk factor. We know about access to food and adequate, not food access, but educational access, and all of these other things can be risk factors within those communities. And then, of course, in the broader society, whether or not there are laws or policies in place that facilitate and or mitigate risk factors. And so, as you know, I know that we talk very commonly in prevention and environmental strategies around, you know, the legal age of drinking or the legal age of purchasing tobacco. Those types of macro level systems policies in society at a federal level or even at a state level can be used as environmental strategies to prevent certain types of behaviors. And of course, there are, depending on the specific primary issue and or target issue or problem that we're trying to solve, those strategies might look a little bit differently. So to mitigate risk factors, we focus on two different things. And again, I know this is a high-level review. I'm going to pull it all together in a minute, I hope. But so we look at protective factors. Protective factors are conditions or attributes in individuals, their families, their communities, or the larger society that help them mitigate those risks that we just talked about. The way that I personally like to distinguish, and this is just Robert's opinion on the universe, feel free to quote me on it, but I haven't published a study or, you know, it hasn't gone through a peer review process. But Robert's opinion on the universe is I like to characterize protective factors as external factors. And in a moment, we're going to talk about resiliency factors, which I like to characterize as internal factors. That just helps me kind of understand the distinctions between the two things. But of course, there may be a nuance somewhere that some creative person comes up with that doesn't align with that. So broadly speaking, protective factors are external things. It's around that appropriate attachment. So we all know, you know, one of the strongest protective factors for adolescent substance abuse is parent-child bonding. And that is protective because it's external to the person. It has to do with this parental figure and or role model figure that they have a close working relationship with that's outside of themselves. Knowledge and education, we obviously know that that's a very core strategy in prevention. Social connectedness, feeling or having, caregiver resilience, and then social and emotional competence. Obviously, individuals that are developmentally delayed and or have co-occurring behavioral health conditions, you know, that is a risk factor, and they are not able to achieve social and emotional competence in certain degrees, right? And so, again, just kind of characterizing how these risk factors and protective factors come into play or interact with one another. So resiliency factors are those internal things. It is our sense of self and identity, including our cultural and spiritual identity. It's our sense of agency, our locus of control. So agency is, by definition, our sense of autonomy and independence. I have agency as an individual. I have my own identity, I have my own personality, I have my own needs, wants, and desires, and goals. When we're talking about locus of control, the distinction being, I have the ability to self-direct my life. I have the ability, while I have my own identity, I also have the ability to make decisions and take actions based off of my needs, wants, and desires. Looking at self-esteem, mastery of tasks, as most folks are aware, one of the core components of building self-esteem is celebrating successes or micro successes, which is why, you know, we want to put those kindergarten drawings up on the refrigerator in the kitchen, and we want to, you know, give a round of applause and a high five after we hit the ball in T-ball and make it to the base. Like, we're building self-esteem and confidence in young children. And even as in adults, the more we're able to accomplish things and celebrate those accomplishments and successes, the more confidence we have in our ability to do things. And that is an underlying foundational contributing variable or factor in our ability to overcome obstacles or cope with stress and or get out of certain addictions. And so another thing I want to talk about, and I think it's an important relevant topic on here, is around safety in the sense of being protected. In the research around PTSD or post-traumatic stress syndrome, one of the recent findings that I heard about at a National Institute of Mental Health conference probably about 2 years ago, is they had just done a study and they found that one of the determining factors whether or not an individual will develop PTSD after a traumatic incident. Two individuals go through the exact same traumatic incident. One of the determining factors around why party A would get PTSD and party B would not is around individuals' sense of safety during the traumatic incident and whether or not they felt that they could get out or exit that incident if they chose to. And we know that in certain types of trauma, you know, escaping and or self-protection isn't an option. But there are other types of trauma or incidents where individuals are able to flee to safety, thinking about like a mass shooting environment or a hurricane or, you know, some of those other types of traumas, like if there was a fire and they lost all their belongings in a fire at the house, if they were able to get out of that house versus if they were trapped inside the house. Those are the types of things that are distinguished in the development of trauma. And that comes into play because obviously trauma is a huge risk factor, and our ability to, and people who have experienced trauma, and we're obviously going to talk about trauma-informed care in about 3 or 4 slides, but individuals that experience trauma are more likely to turn to coping mechanisms such as substance use. So I don't want to get too far ahead of myself, but are there any questions about risk factors, protective factors, or resiliency factors before I move on? All right. So the next layer that I'm going to add to this mix is Erikson's stages of development, or the stages of human development. I like Erikson's model. There are dozens of models out there. Everyone is just a little bit different. But they essentially, you know, kind of define the social development or psychosocial development of individuals. The reason why this is important in our prevention work is, as you know, we need to define a target population. And that target population lives somewhere in the developmental framework, right? And so using a life course perspective, we want to look at where are people in their development. And then again, we're going to talk about trauma in a minute and how some of these pieces come together, but acknowledge how pro-social adaptive development helps people, you know, move along this continuum. But when there are unmitigated risk factors that either incidences of trauma or perpetual experiences of chronic stress, those individuals are going to turn to the maladaptive forms of development. And so on the top, you see the pro-social, adaptive, positive forms of development. And on the bottom of this timeline, you see the antisocial and or maladaptive, negative, quote unquote, bad forms of development. And so the reason this is important in our prevention work is that based on the population that we're working with, we need to tailor our approaches to focus on the specific population and what their experiences include. And we can talk about how that threads together in just a little bit, but the stages of human development are very important. And I'm not going to go through this slide because I think that this is pretty well known and typical. If you're unfamiliar with Erikson's stages of development, you can type that bad boy into a Google search engine, and you will find a whole host of information about it. So I strongly recommend being familiar with this and incorporating it into your work. So as we talked about a couple minutes ago, ecological systems theory is one of the core underlying frameworks that guide prevention efforts, and specifically the strategic prevention framework. We mentioned previously that risk factors exist at each of the levels ecological systems model. So do protective factors. Part of our work in prevention, as we're focusing on our target populations and target issues, is looking to build those protective factors at each of these levels. One thing I want to note and caveat is this is Robert's adapted version of the ecological systems framework or theory. And so in the traditional model, you see self, family, community, and society. I have added this second circle, individuals. And I did that because there are lots of populations, specifically high-risk populations, that do not rely on their biological immediate families for support. This includes children in the foster care system. This includes unaccompanied minors who are immigrating into the United States. This includes many individuals or survivors, children who are survivors of different forms of abuse, whether or not they are in the foster care system. And there's also other segmented populations where the individuals around them can be more significant. Their youth pastor, their teacher, their student resource officer, their best friend's parents or family members. And so it's almost a family of choice concept and or those role models that come into play. And so again, the point of this theory is to focus not only on or acknowledge not only that risk factors exist internally within the self, in the individuals around us, in our families, communities, and society, but that the work of prevention is to institute or instill protective factors, again, external things, at the individual's family, community, and societal level. And then we're going to focus on building resiliency factors in the internal self. Again, resiliency factors are internal. Any questions on this before we proceed? All right. So the other framework that I always really want to reinforce, and this is Maslow's hierarchy of needs. And the reason why this is so relevant, and for those of you that maybe work in the formal behavioral health system or healthcare system, in addition to your prevention work, or in addition to your community prevention work, excuse me, you're probably very aware that in one of the hot topics in healthcare today is really focusing on social determinants of health. And again, for those of us that have been in this work for a long time and in this field for a long time, it's not shocking or surprising for us to learn or know that people need food, shelter, clothing, transportation, safety. They need family support in order for them to fully engage in school, fully engage in athletics or after-school activities, fully engage in pro-social supportive relationships with their peers and other adults. These underlying basic human needs, the social determinants of health, really do play a significant role in our community-based prevention work. And some of these basic human needs and or social determinants of health may very well be the contributing causes or the underlying causes as to why individuals are turning to substances in our communities. I'm going to anecdote very briefly. But I spent a couple of years living in Baltimore in 2016 and 2017. And Baltimore has one of the highest, the second highest murder rate in the United States, and probably some of the most extreme poverty that I've ever seen. And I lived in the slums of India for 6 months. And Baltimore literally, in my opinion, does rival that level of extreme object poverty. And I was having a conversation with someone whose daily job is to prevent homicide in Baltimore City. And one of the things that they said was so poignant to me is, you know, people who have enough resources to buy food or pay their rent and or, you know, pay their car payment and insurance and be able to use a vehicle that is operational and functional, to them, $5 or $3 is not a significant amount of funding typically, right? And yet in Baltimore, there were people that would literally commit homicide for $3. And in this conversation with this guy, we were talking and he was like, you know, $3 is enough to go to McDonald's and buy a meal for you and potentially your family. And, you know, when poverty is so extreme, individuals, the social determinants are the contributing causes. Individuals are looking for ways to cope. They are looking for ways to release stress, to escape and get away. These are all natural biological fight, flight, or freeze responses in the human body. This is how we are genetically and biologically wired, is to fight, flight, or freeze away from pain, stress, trauma, anguish, those types of things. And so the way that some of these behaviors operationalize or actualize themselves, materialize within society is through some of these unmet social determinants of health. And these issues often result in maladaptive or negative coping in the behaviors that, you know, we are, as prevention experts and individuals, are working to prevent, such as substance abuse, such as crime, such as some of the other issues that I know all of us are deeply connected to and working towards. So the point of talking about Maslow's hierarchy of needs here is just simply to acknowledge that some of these basic human needs are the true underlying issues that are contributing and or causing the substance use and or other topic areas that we are working to prevent. And so a failure, you know, if we're focusing on building someone's self-esteem and they're focusing on finding food to eat for the night or shelter, you know, we obviously are misaligned. And we need to make sure that we are aligning our strategies and our efforts and our work to help support these individuals and what their true underlying needs are. Any questions on Maslow before we move on? Okay. Another, you know, very common framework today is trauma-informed care. For many of us, you know, we've been hearing about this for some time. This study was completed in the early 90s or was published in the early 90s. And so we're talking 30 years ago, but it really kind of came to the forefront of behavioral health and healthcare, you know, really within the last 10 years, at least my understanding. Or my experience. And so as everyone is probably aware, trauma-informed care stems from the ACEs study, the Adverse Childhood Experiences study, and essentially it says that individuals that have adverse childhood experiences, which could be anything, it could be, you know, very extreme forms of abuse, neglect, and exploitation that we, you know, may traditionally think of, physical abuse, sexual abuse, those types of things, but it could be minority stress, which is just the chronically high levels of stress associated with being in a minority in the United States. There's a whole framework that I was working on writing a book about called psychoneuroimmunology, and there's another medical framework called psychoneuroendocrinology, which is around how the physical body responds to chronically high levels of stress and how it can obliterate and destroy your immune system, resulting in autoimmune disorders, up to and including forms of cancer. and there's a whole body of medical research that supports that framework. The other one, psychoneuroendocrinology, is similar, except that the reaction is within the endocrine system, resulting in hormone imbalances and malfunctions of your endocrine system. And so, you know, again, those can also result in a significant array of health complications and chronic health conditions, up to and including cancer and early death. And so, you know, adverse childhood experiences, this study actually really demonstrates that model. So individuals that have these negative experiences or these traumas early in their life, they experience social, emotional, and cognitive impairment over time. It develops because they are trying to cope emotionally with this experience that they had in their childhood, which leads to the adoption of health risk behaviors, coping mechanisms, right? So that could be, you know, turning to food to cope. That could be turning to tobacco, alcohol, any other types of substance. It could be turning to negative relationships or codependency or other issues. Those types of maladaptive coping, as we learned in Erickson's stages of development, those result in disease, disability, and social problems. So, you know, if you are obsessive compulsive overeating, you're going to find yourself in, you know, the category of obesity, and obesity has a whole list of negative and harmful effects, including diabetes, including liver conditions, kidney conditions, you know, all kinds of things. If your adoption of health risk behaviors results in tobacco use, right, then we obviously all are aware of the harmful effects of using tobacco and smoking. And so, you know, you can end up with COPD or lung disease, congestive heart failure, chronic heart failure, all of those things. And then those are the things that result in early death. And so the point being is that from a psychosocial framework and perspective, these young childhood experiences obviously play a role in the early death of other individuals, and trauma-informed care is simply a map of how those things are all connected. Again, you can see here that our job, one, would be to prevent adverse childhood experience. The research on resiliency factors and protective factors actually would attribute and help mitigate adverse childhood experiences. But then we look at secondary prevention, right? Like the incident has already taken place. We just need to early detect it, and we want to get in there as quickly as possible to start implementing tertiary prevention. So the secondary prevention would be identifying it and screening it. The tertiary prevention would be let's address this trauma and mitigate its harmful effects and hopefully return people to appropriate functioning. And so looking at some of these other behaviors to address social, emotional, and cognitive impairment, life skills, interpersonal communication skills, self-esteem building programs, you know, all of those types of things that promote resiliency factors. These are the things we do in prevention every day. And then for those individuals that have adopted those negative coping mechanisms or behaviors, tobacco, alcohol, other drugs, you know, using tertiary prevention strategies to get them into appropriate treatment so that they can mitigate those long-term effects. So I'm going to move on, but before I do, are there any questions about trauma-informed care? Okay. I hope was able to be articulated. Have actually include that kind of pulls all of those frameworks together. But for the sake of time, since today's session is only an hour and not 8 hours, which I could clearly talk for 8 hours, I only presented those frameworks, but I hope that everyone was able to conceptualize how those different things work together. Again, I know I started off very abstract and kind of at a micro level. We're talking about everyone's individual lives, experience, and include all of the frameworks we just talked about. Everyone has experienced different forms of trauma. Everyone evolves and develops on Erickson's stages of development. Everyone has risk factors in their life. Everyone has various protective factors in their life. Everyone has various resiliency factors in their life. Everyone has basic human needs according to Maslow's hierarchy. and we all live, move, and breathe within ecological systems. So that applies to absolutely everyone. My hope is that we would be able to take that knowledge or the consideration of how those things kind of all, what's the word I'm looking for, pinball around off of each other, those concepts, and start applying them into the strategic prevention framework. And so I'm going to go over kind of what is the strategic prevention framework as a way to operationalize some of this. And so we'll be able to move forward or kind of tie it all together, I hope. So again, most of you guys that have been doing this work for a while, you should have some level of familiarity with it. Here's kind of the textbook version of this. The strategic prevention framework stems from or is a part of, it's embedded within the Federal Substance Abuse Block Grant, which the acronym is SABG. Other people call this SAPT, which is a Substance Abuse Block Grant, or I'm sorry, Prevention and Treatment Block Grant, excuse me, Substance Abuse Prevention and Treatment, SAPT. It's also known as the Substance Abuse Block Grant, SABG. So if you see either one of those acronyms, they are the same. But the Substance Abuse Block Grant targets services for pregnant women and women with dependent children, intravenous drug users, tuberculosis services, and early intervention services for individuals with HIV and AIDS. So those are treatment services traditionally. And that extends from regardless of one's eligibility or insurance coverage. If you don't have insurance through your job and you are not on Medicaid, there are still resources available through the block grant that can help serve and support those four populations and or service types. The fifth layer is primary prevention strategies, and that's obviously where we come into play. You'll notice that SAMHSA requires that no less than 20% of the block grant be used on primary prevention. This is where Arkansas gets its funds for this training and the work that UALR supports through its prevention strategies. And so this is kind of the federal high-level overview. Question on the right-hand side, we're going to do a little bit of engagement. If you will jump in that chat box and let me know. How familiar are you guys with the substance abuse block grant? Type of 1, if you're not at all familiar, this is the very first time you're hearing about it. Type of 2, if maybe you've heard about it before, you're not really clear on it. 3 with a somewhat, 4 with a very, and 5, you helped write the application and you know all that there is to know and or extremely familiar with the block grant. Awesome. Okay, so we're getting a good, you guys are super savvy. This is great. So I will rush through some of this content then. And so while these are two different independent mechanisms, the strategic prevention framework is most often funded through the Substance Abuse Block Grant. It provides funds in all 50 states, including territories, and the objective is to help plan, implement, and evaluate activities that prevent and treat substance use. And you guys will get a copy of this PowerPoint, so that's why I'm moving a little bit quickly through some of these slides and taking a little bit more time on some other ones. The strategic prevention framework, and this is all stems from SAMHSA, it was designed to promote youth development, reduce risk-taking behaviors, build assets and resilience, prevent problem behaviors across the lifespan. So I hope you can see some of the connection between the theories and frameworks we talked about just a couple of minutes ago. Looking at youth development, that's Erickson's stages of development, right? When we're looking at reducing risk-taking behaviors, those are those risk factors we talked about. Building assets and resilience. Assets and resilience are another way that protective and resiliency factors are often framed. The language is essentially synonymous with protective and resiliency factors. And then preventing problem behaviors across the lifespan. So again, that's looking both at ecological systems as they evolve, as well as going back to Erickson's stages of development. So the goal is obviously to use public health research along with evidence-based prevention programs to look at building community capacity and sustainable prevention. And I believe in the series that we're going to be doing together, we're going to be unpacking some of these concepts a little bit more and talking about some of it. I know on my YouTube channel, there are several presentations I have done over the years for UALR that are specific to Arkansas, and they really do deep dive into each step of the strategic prevention framework. So you are more than welcome to go check those out. So according to SAMHSA, the SPF or strategic prevention framework requires states to assess their prevention needs based on data, build their prevention capacity, develop a strategic plan, implement community prevention programs, policies and practices, and then of course evaluate their efforts, which is how we land here, which I'm sure everyone on this webinar has seen this before, but this is the model. The thing I like to call out about the strategic prevention framework is it's not a theoretical model, it is a process model. And so it aligns very closely to other forms of process models in quality management, which is something HRSA and the Centers for Medicare and Medicaid require. We use like the Plan, Do, Study, Act, or Plan, Do, Check, Act model, and it really follows this. That's a 4-step model. This is a 5-step model. But so it starts off with that assessment, and we will do a little bit of conversation around assessment in some subsequent trainings. And again, check the YouTube channel for very specific content on each one of these items. We focus on capacity building. This is an example of capacity building, but my definition, and again, it's just Robert's definition of capacity building, is how you either recruit or build the resources that you need to build capacity. So you either bring in an expert to help you do something, and or you go out and do your own research and or develop whatever tools and strategies it is that you need. So this could be a procurement process. If we're doing a public health campaign and we need a graphic designer and someone to put the billboards up and things like that, you know, you're really learning about what it's going to take to get the job done, doing a deep dive in some of these strategies. And then you dive into strategic planning. The reason capacity building happens before planning is it results in informed strategic planning. So you walk into that room as subject matter experts, not only in the needs of your community because of the needs assessment, but also in the different strategies and tactics that are at your disposal and that are available to you for you to be able to pull together a realistic plan. And of course, in planning, we focus on SMART goals that are specific, measurable, attainable, realistic. And that's why capacity building is so important, and then time bound. Implementation, you do the work. Evaluation, you evaluate whether or not you did what you said you were going to do. That's a process evaluation. And then whether or not it resulted in the desired effects or the desired outcomes. For those of you that have had the privilege of pulling together logic models, that is the purpose of the logic model, is to help define the outcomes that you're wanting to produce. I'm a big fan of logic models, but not everyone is. And so looking at that evaluation piece, and then the core piece in the middle is that throughout all of these steps, we're looking at sustainability. Is it realistic? Can it be sustained over time? If we could send absolutely everyone, you know, to live with a perfect family, or give everyone a live-in like family coach to mitigate all of the interpersonal conflict or family issues, we absolutely would do that, right? If we could lift the world out of poverty tomorrow, you know, with the snap of a finger, I hope that we would all seek to do that. But those things tragically and unfortunately are not sustainable, and they're not realistic. And so we oftentimes find ourselves creating incremental change, which is one small step forward at a time. And so looking at, I should have included the stages of change and readiness in this slide deck, so forgive me. But using the stages of change or theory of change and assessing where our communities are at, we take one step at a time forward, and ensuring that those steps are sustainable. And then, of course, looking at it in a cultural competency way, which is focusing on the unique cultural makeup and customizing or personalizing our strategies to the communities and populations that we're working in. In Arkansas, I know that we have a beautifully diverse population that lives in the state, both social and economic diversity, faith diversity. I know that there are lots of pockets of communities around the state of Arkansas, and these strategies should be custom and tailored to the unique experiences, urban versus rural. Those types of things, really do need to come into play in order for our strategies to be successful. Any questions or comments on what the strategic prevention framework is and or its steps before we move on? And just to give you a heads up, the last 4 slides are going to attempt to pull together and distinguish between primary prevention, secondary prevention, tertiary prevention, related to universal, selective, and indicated strategies. And so before we kind of dive into some tangible examples of how these things play together, primary, secondary, tertiary prevention, universal, selective, and indicated strategies, are there any questions about what the strategic prevention framework is and or the theories or frameworks we've talked about so far? And please type those questions in the chat box if you have them. Okay, I'm not seeing anything, but I will come through. And Amy, I appreciate your passion for logic models. Very few of us share that passion, but I love them. I use them all the time. So I'm glad to see we have some shared excitement over there. So when we're talking about primary prevention, again, primary prevention is focused on preventing something from ever happening. This is a core where we, in community-based prevention, and again, the strategic prevention framework, the substance abuse block grant specifically funds primary prevention. And so, these are the types of things that we are funded to focus on and that we are designed to focus on. And so some examples of universal strategies, again, universal strategies apply to everyone in the population, no matter what their risk factors are, no matter what their experiences are. Every single person gets the exact same environmental strategy. And so environmental strategies include things like your liquor laws, your city zoning, rules around how far away from a school or a church a liquor store needs to be. Those are environmental strategies. They apply to everyone. And so the legal age of drinking, the legal age of purchasing tobacco, whether or not marijuana is legal for medicinal or recreational purposes, like these are all environmental strategies. The other component universally that applies to everyone are public health campaigns or strategies that are intended to be universal, right? So billboards on the side of the road, television ads that play, during peak news time on kind of like the local channels, NPR radio interviews and or local radio interviews that are just going to be on air for anyone to listen to, that are not designed to target a specific demographic. These are all universal strategies for primary prevention to increase awareness and education. And if you remember, one of the protective factors for substance abuse is parents' knowledge about the risks and harmful consequences. And so a lot of the work that we do specifically to move people along the stages of change and the readiness for change dial is education and awareness building. And so I know this is very, very common. Territoriality is an interesting strategy that I've been using at with another organization I'm doing some work with recently. And it's not something that I had really read about in the community-based prevention literature, but I do think that it plays a specific role. So territoriality is largely around making your presence known. And so there are certain things, for example, the reason why a law enforcement officer or a security personnel needs to be present or may sit on the side of the road in uniform or in their vehicle, in a marked vehicle, is for the purposes of territoriality, making their presence known. letting the world know or letting the community know that there's a watchful eye and there is someone there to help in the event of a need arising. And so what this looks like in other areas are neighborhood watch programs, signs. This is a neighborhood watch. We have one. We're watching you. That is a great example of where territoriality, posting those signs, increases awareness and lets individuals like foreigners, people that don't belong in that neighborhood or aren't from that neighborhood or that suburb or that community, lets them know that there are people self-managing and or that are being vigilant to ensure that bad behaviors are not taking place. So territoriality is an interesting strategy. It can be done at a universal level. It is intended to be prevention, or primary prevention, excuse me. Policies, procedures, and performance standards are another way that we look at primary prevention and universal strategies, focusing on municipal or city policies. So that could be like VAT taxes, or also known as like sin taxes. So this is why, and actually this is where substance abuse block grant dollars typically come from, are the taxes on alcohol and tobacco sales. So if we increase those taxes, we are de-incentivizing, we're pricing those products higher, so they're less accessible and attainable, and those tax dollars are typically routed back to prevention efforts or treatment efforts, depending on the municipality. So, looking at passing city, county, or state level policies through law are great options for universal prevention. Selective strategies, those examples include vaccination. Social distancing is one where we've all been living in because we know that there is a potential risk. Background checks, for individuals that work with children, that's a selective strategy because, again, we're only focusing it on certain types of people that work in certain conditions. We talked about fluoride-treated water. Fluoride-treated water is selective because it is focused on preventing waterborne illness. And so it's primary because we're preventing waterborne illness from ever happening. It's selective because it's only focusing on waterborne illnesses in the public tap or in the public water system. Doors and drawers is a policy I've been using a lot with inpatient settings, preventing kiddos that are in foster care group homes and or residential treatment settings from getting access to scissors or medication or things that they could self-harm with or harm other people with. So again, depending on what level of prevention we're working on, these things all kind of look a little bit different. And then indicated strategies, again, also looking at kiddos that have defined or we're able to identify a specific condition, and so that might be transferring them or getting them into an appropriate level of care. So children that are being abused or neglected, getting them out of that situation and getting them into foster care where they could have safety, or at least intention. The intent is for them to have safety. That is an indicated strategy. Another example, looking at substance abuse, primary prevention, indicated strategies would be focusing on individuals that are at the highest risk population for substance use. And looking at prevention strategies that focus on them. So, I haven't looked at Arkansas epidemiology data, but traditionally, kiddos in foster care, kiddos with lower school engagement or educational engagement. So if you look at kiddos that are getting suspended or written up or whatever, you could look at indicated strategies for them. And so as opposed to sending them home or kicking them out, we could focus on engaging them in appropriate types of services and supports to prevent them from turning to substances or other types of maladaptive behaviors. So I am unfortunately getting the 3-minute warning, and so I know that we need to move quickly. The next two, I wanted to deep dive on prevention, or primary prevention, excuse me, because that is what the Substance Abuse Block Grant funds. and our work in community-based prevention. Just to give you very, very quick examples of secondary prevention strategies, this is where we start doing screenings. We screen people for tobacco and substance use. We do active surveillance, so individuals that are suspended for substance use or having tobacco on their person. We're starting to track those types of things, looking at routine and trended reporting. This is where epidemiology comes into play. If you do needs assessments on an annual basis, you can compare last year to this year and look at benchmarking and ways to identify where we're at. Are we achieving those goals we set out on our logic models, or are we degressing or regressing? Randomized audits definitely applies in certain settings. And so if you're at a healthcare clinic and you can do a randomized audit of medical records, you could look at individuals with substance abuse histories and or other types of conditions and check to see what types of strategies they've engaged in. Again, we talked about the annual wellness visits, things like that. And so you guys will all have copies of this presentation, so I'm not going to go through each one of these. But this is where a lot of quality management types of activities happen within healthcare settings. We're just trust but verify. So in-home drug testing would be an example of a secondary prevention strategy specific for substance abuse prevention. I do want to clarify, there's actually, this statement is not accurate. Tertiary prevention is not always indicated prevention, but it does align or feel very similar to it. And so, again, tertiary prevention is after the condition's been identified. We're reducing the harmful effects. And so once someone has developed a substance abuse condition, how do we get them into treatment and move them on? Indicated prevention is, what's what I'm looking for? Not segregating, segmenting, thank you, segmenting your populations and stratifying them by known risk factors. And so it's not always, they're very similar and they look alike and they can be easily confused, but they are not identical. And so that top statement is actually inaccurate, and I apologize for misleading you. We're out of time, but the goal of prevention is to build protective factors and resiliency factors that promote adaptive coping. So focusing our efforts specifically on these types of things through our educational campaigns, through our outreach programs, through our interventions, through the curriculum that we're using, through our policy. These are the things on a macro level, meso level, or micro level at all systems that we want to build. I apologize that I think I went a minute over. Derek has posted the evaluation link in the chat box, so please go to that link and fill it out. You need to fill that out within 48 hours so that you can get credit for participating in today's session. On this last slide is my cell phone number, so you can call me at any point in time, text message me if there's anything that you need from a resource perspective, and of course you can email us. And if you want to learn more about the work that we do, go check out our website, please. Definitely enjoy having people learn more about us. So I'll stick on the line for any questions, but otherwise we are adjourned for today. Thank you so much for all of your time.